Good morning, I'm Joe Fryer.
And I'm Savannah Sellers. Right now on Morning News Now, critical vote, a battle over the future of American democracy. This morning, Congress under pressure to expand voter protections, with Senate Democrats planning a vote on 2 new bills as soon as today. This after a call to action by President Biden, who expressed his support for changing filibuster rules to pass the legislation.
The battle for the soul of America is not over. Protect our democracy. I support changing the Senate rules, whichever way they need to be changed to prevent a minority of senators from blocking action on voting rights.
We have the latest on the growing confrontation and reaction, including the 2 Senate Democrats who could put an end to the president's plan. Strained, the U.S. struggling to recover from COVID's winter wave. Hospitals and hospital workers overwhelmed by Omicron patients, with the number of new cases now at a pandemic high and staffing critically low. Now, some workers reporting for duty even if they have the virus themselves. This as the nation's top health officials face questioning on Capitol Hill about those mixed messages on guidelines for isolations, and teachers being pushed to the brink as the surge takes a toll on the education system. More on the fallout 2 years into the pandemic. And officials are calling it an absolute miracle. 4 people, one of them just 2 months old, survive after a medical helicopter crashes just steps away from a church. The incredible story of survival and the investigation now underway. Finally this morning, a squashing success, a story about overcoming the odds, how an immigrant from Mexico found comfort and confidence through the game of squash. That's a good one we'll have later for you this hour. And It's not in our headlines, but it is still very cold out here.
It is still very cold, but warmer, I guess.
Yeah, a little bit
Less
better.
windy.
Hopefully that's the case for some of you, too, waking up in the Northeast or the Midwest. We begin this morning, though, with a renewed push for action on voting rights as President Biden calls for a major change to Senate rules.
Democrats want to move quickly. The Senate could vote on 2 federal voting rights bills as early as today. In a speech in Atlanta yesterday, President Biden lambasted the Senate for not taking action and framed this issue as one for the history books.
I ask every elected official in America, how do you want to be remembered? Do you want to be on the side of Dr. King or George Wallace? Do you want to be on the side of John Lewis or Bull Connor? Do you want to be on the side of Abraham Lincoln or Jefferson Davis? This is the moment to decide.
NBC News White House correspondent Carol Lee joins us now from Washington. Carol, good morning to you. So the president's speech marked really a big reversal for President Biden, an institutionalist who spent years defending the filibuster while serving in the Senate. So how exactly is the White House planning on getting this done? Can they realistically do it?
Yeah, Joe, look, they're going to try, but the votes just aren't there right now. And you're right, this is a really significant reversal for President Biden, who spent decades in the Senate and for years now has said he opposes changes to the filibuster. But yesterday in his speech in Atlanta, he said things are different now. Take a listen.
Sadly, the United States Senate, designed to be the world's greatest deliberative body, has been rendered a shell of its former self. Gives me no satisfaction in saying that as an institutionalist, as a man who was honored to serve in the Senate. But as an institutionalist, I believe that the threat to our democracy is so grave that we must find a way to pass these voting rights bills.
So how's the White House going to get this done? Look, unless they can get all 50 Democrats to support getting rid of the filibuster altogether, this is impossible because they need 67 votes in the Senate to do anything short of what's called the nuclear option. So something like a carve out for voting rights, or the talking filibuster, as it's known, forcing senators to stand on the Senate floor and talk through a filibuster. So it's just looking increasingly like this is a non-starter, Joe.
I mean, Carol, it's worth noting so far no Republicans in the Senate have come out in support of these bills. Obviously, they're not needed if the filibuster rules change. But how are Republicans reacting to the president's call for change yesterday?
Right. Republicans have been blocking this voting rights legislation, which is why Democrats are talking about changing the filibuster. And no surprise, they were sharply critical of the president's speech. And Senate Minority Leader Mitch McConnell even said if Democrats were to go down this path and try to get rid of the filibuster, that he would really make it harder for them to get anything done in the Senate. Take a listen.
If my colleague tries to break the Senate to silence those millions of Americans, we will make their voices heard in this chamber in ways that are more inconvenient for the majority and this White House than what anybody has seen in living memory.
So other Republican senators came out and were criticizing the president, saying that his speech was overly political. But look, Joe, that wasn't the president's audience. The president's audience were Democrats in the Senate and the Democratic base, who's been really putting a lot of pressure on him to make a speech like this and lean into a push for voting rights legislation.
Of course, ultimately what matters here are the moderate Democrats, Joe Manchin and Kyrsten Sinema. They've said they oppose changing Senate rules. That, of course, sinks the Democrats' efforts, as you pointed out. How does the White House plan to get them on board? Because that's everything for them right now.
It is. You're absolutely right. And look, they're saying, hey, we're going to have all these conversations with senators. We're going to use the bully pulpit. The president will continue to hit on this issue publicly. And the president said yesterday that he's had conversations with Democratic senators in recent weeks about this. But all of that talking is not going to change the fact that even Senator Manchin, for instance, has really dug in on his opposition to getting rid of the filibuster. And absent that, it's just hard to see where this goes.
Carol Lee reporting from the White House. Carol, thanks so much.
Now, notably absent from President Biden's speech in Georgia yesterday were some key voting rights activists. Some of them have slammed the White House, saying anything short of a concrete plan to pass voting rights legislation is unacceptable. Meanwhile, Republicans say they're not trying to restrict voters. NBC News correspondent Blaine Alexander is in Atlanta with the latest.
I'm Blaine Alexander in Georgia, where organizers tell us it's a race against the clock to pass Democrats' new voting legislation.
Democracy hangs in the balance.
But they're worried President Biden is speaking up too little, too late. His Georgia trip marks a return to the state that gave Democrats the Senate majority. But he's being met with an icy reception from some of the very organizers behind those victories. While some voting rights activists are in attendance, others choosing to skip the speech, calling anything short of a concrete plan to pass Democrats' legislation unacceptable, an empty gesture. Georgia has progressively become more progressive, narrowly flipping for Biden in 2020 by less than 12,000 votes. Now, the groups that helped drive record Democratic turnout say to bring voters out again, it's time for a return on their investment.
What is your biggest fear if this legislation does not pass?
Our biggest fear is we have nothing to say to these voters as to why they should come out again in the midterms and make their voices heard, because this administration has given us there's no meat on the bone.
Republicans are defending Georgia's controversial new voting law, slammed by critics as voter suppression. Governor Brian Kemp says it's the opposite.
Georgia's Elections Integrity Act makes it easy to vote and hard to cheat.
Last year, President Biden told Georgia Democrats electing 2 Democratic senators would mean a green light for his agenda.
The power is literally in your hands.
Now the pressure is on from Democrats for him to deliver. And some of those activists told me that they liked what they heard in the speech, but they wanted to hear the president call out some of the holdouts in his own party. In Atlanta, I'm Blaine Alexander, NBC News.
This morning, the out-of-control Omicron variant is putting a bigger strain on the nation's hospitals.
Yeah, COVID hospitalizations have now reached a record high, with more than 145,000 people currently admitted with the virus. That means about 1 in 2,300 Americans are hospitalized with COVID right now. As nurses and doctors try to treat thousands of new patients, the nation's top health experts were on Capitol Hill yesterday trying to defend the CDC's mixed messaging on Omicron and quarantine guidelines.
A core part of CDC's mission is to translate science into recommendations for best practices and real-world circumstances. As we will learn more, we will continue to update accordingly. Omicron is likely not to be the last curveball this virus throws at us, but we have the tools to prevent further spread of this virus.
Hospitals right now, they were trying to fight the curveball Omicron has thrown at them. They're running out of hospital beds and workers as some staff come down with the virus themselves. That includes doctors in North Carolina, where we find NBC News medical reporter Erica Edwards. She joins us now from a testing site in Charlotte. Erica, good morning. So let's talk about the hospitalizations first, just there where you are. How is it in the Carolinas? Are the hospital systems holding up with this Omicron surge?
Yeah, hey, Savannah, good morning. I'll tell you what, cases here in the Carolinas have absolutely exploded in the past few weeks. What's more, that means people who are getting COVID-19 are sick enough to be hospitalized. Check out some of these numbers. In South Carolina, the number of COVID-related hospitalizations has risen more than 1,100% in the past 2 weeks. Unbelievably, that is not a typo. In North Carolina, hospitalizations are up 768% in the past 2 weeks. Compare that to the national numbers, not doing much better. Hospitalizations have quadrupled in the past 2 weeks. Now, despite this, we talked with an infectious diseases expert at Wake Forest who said that there's a bit of good news here. People who are hospitalized aren't necessarily as sick as they were earlier in the pandemic. Take a listen.
We're about 25% higher than we were at this time last year. And last year was obviously the previous big peak for hospitalizations. But we are seeing fewer people in the ICUs compared to last year, and also even compared to Delta in August and September. So there's a little bit of a silver lining there.
Still, Dr. Oles said the sheer rise in cases is absolutely crippling the healthcare system. Savannah, Joe?
Erica, we just heard CDC Director Walensky defend her agency's messaging. That includes the guidance on quarantines. Even with the shorter 5-day isolation period now, a lot of hospital workers still can't get back to work right away. What is the impact on those who are going to the hospital for things other than COVID?
Put simply, they cannot get the care that they need. Let me give you an example. At Duke University Hospital in the Raleigh-Durham area, there were more than 1,000 healthcare workers out sick in isolation because of COVID-19 within the past week. And that means that there are fewer doctors, fewer nurses to take care of those routine, everyday illnesses. We talked with Dr. Cameron Wolf of Duke University Hospital. Here's how he explained the problem.
Someone who was due to get an elective surgery can't, it gets cancelled. It means someone who sits in the ED for their broken leg likely sits there for many more hours. It means someone who needed a clinic visit may have that clinic visit cancelled at the last minute because we can't get staffing for that visit. It bleeds into other areas of healthcare, not just COVID.
Dr. Wolf said that in a matter of about 3 weeks, they went from having 60 hospitalized patients with COVID-19 to 260. That's a faster rise than they'd seen before in the pandemic.
Wow, yeah. Now, Erica, also the testing site you're at, as many across the country have seen, are seeing this major rise in positive test results. One of the issues, though, that we're hearing about is access to testing. If you're not at one of these sites like you're at, you can't get your hands on an at-home test, that type of thing, which also may mean we're actually way above the numbers that we're reporting here in terms of positive cases. What are they doing in that state to make sure people do have access to testing?
Yeah, that's really happening at the local level. Local governments, local healthcare systems are trying to help fill that gap and that void. In Durham County, to my northeast, local health officials there distributed thousands of free at-home rapid test kits to the public. Masking is another huge way that they're trying to sort of rein in this problem. Durham County also sent out tens of thousands of masks. Here in Charlotte, the large hospital system Atrium Health announced just yesterday that it's donating 200,000 of those KN95 masks. Those will go to the local health department. That's where those masks will be distributed to testing sites like this one, where they'll go to the public and the healthcare workers actually doing that testing.
All right, Erica Edwards in North Carolina. Erica, thank you.
Let's now bring in Dr. Amish Adalja. He's a senior scholar at the Johns Hopkins Center for Health Security. Dr. Adalja, always great to see you. Thanks for being with us. So just a moment ago, at the beginning of when we first started talking to Erica, we heard from a doctor who spoke about this silver lining with this Omicron surge. So despite the high number of hospitalizations, fewer are ending up in the ICU. Obviously, that is a little piece of good news. What do you think that tells us about the severity of Omicron? And does this mean maybe we get past this surge in a way that's hopefully not too far off?
What these anecdotes tell us is that what we saw in South Africa, those early reports of less severity, less ICU bed utilization, is likely true. However, this is something that is just a silver lining. It's not completely a way that we're going to dodge any bullets with Omicron, because it's still severe enough to put hospitals into problems, especially hospitals that had already been hit hard with Delta, hit hard with staffing problems. But it is something that I even noticed myself rounding this weekend, that I didn't see as many sick patients with COVID-19. I saw a lot more people who were testing positive who were admitted for other reasons, which is clearly different than what we saw in the past. And I think that's good, but we still have a couple of weeks to really get through to make sure that our healthcare system doesn't collapse.
And I think that's an important distinction there when we talk about the numbers. People who have COVID but are hospitalized, not necessarily because of COVID, which to your point is different than in the past. I want to ask you now about schools. So this morning, the Biden administration announced increased access to testing for schools nationwide. That includes 5 million free rapid tests for schools each month, an additional 5 million PCR tests a month for any individual, and pooled testing needed, and also an expansion of community testing access. So we've seen the concerns about teachers, like, for example, in Chicago, about returning to the classroom, and here in New York City, hundreds of students actually staged a walkout over COVID concerns yesterday. Is this level of testing enough to ease students' and parents' minds? What else do you think needs to be done to make the classroom safe?
Testing is going to be a major component of keeping kids in school. The CDC has really great guidance on something called Test to Stay, where you don't have to quarantine an entire classroom for an exposure. But the success of that type of program is really premised upon having enough tests to be able to do that. So it's going to be important for the foreseeable future that schools have ability to test. It's also true that schools need to have vaccination rates higher. We know that children tend to be one of the least vaccinated groups in this country. Having more vaccinated children makes a school more resilient. It's also something where teachers need to be vaccinated, because if teachers aren't vaccinated, they may call out sick more frequently. They may get severe disease. We want teachers to be vaccinated almost as a condition of employment, if that can be possible in a school district. And then masking and social distancing are going to be important based upon what's going on outside the classroom walls.
And Dr. Adalja, quickly, another question on testing for you as it relates to the Omicron surge. So the Abbott at-home COVID test, something a lot of us might recognize at this point in the pandemic, can detect most infectious Omicron cases. Now, there's been a lot of concern about whether a lot of these rapid tests that you're just able to buy yourself at a drugstore can effectively detect this particular variant. If people think they have COVID, what should they do? Should they get one of those tests? Should they also get a PCR test? What should people do, especially if they are symptomatic?
If you're symptomatic, the first step should be one of those antigen tests, because if it's positive, that gives you your answer. But if it's negative, you still have to figure out what you're sick with. Is it COVID? Is it influenza? Is it strep throat? So you should still isolate and then get more formal testing. And whether that's a COVID PCR test or a formal antigen test at an urgent care center, or get tested for flu, that's kind of all the steps that you need to take. You shouldn't just ignore you shouldn't just ignore your symptoms if you have a negative test. You need to figure out what you're sick with.
All right, Dr. Amish Adalja, great advice there. Thanks so much. And as you all at home have probably noticed, we talk to doctors here every day, and we want to know what you want to know. If you have a question about COVID, maybe this variant, maybe you're unvaccinated and have concerns, we want to get questions straight from you to our doctors. Email us at morningnewsnow@nbcuni.com. There it is right there. I know it's a long one. With your questions for our doctors, and we'll get them on the show.
COVID has been dimming the lights on the Great White Way over the past few weeks. As we've extensively reported, Broadway bounced back to standing ovations last September. But now the surging Omicron variant is shuttering some of New York City's top shows. This morning, we're hearing from those directly impacted by those closures. The almost wildfire-like spread of Omicron threw a wrench into the holiday peak that Broadway has grown accustomed to. 4 productions shuttered their doors early. The play, Thoughts of a Colored Man, and the musicals, Jagged Little Pill, Ain't Too Proud, and Waitress. For many in the Broadway community, it felt eerily similar to the 2020 shutdown.
I think all of us have emotional impacts of that shutdown that we have probably not fully dealt with, myself included, by the way. So it's almost like having PTSD.
Broadway's initial closure nearly 2 years ago sent shockwaves throughout the entertainment industry and New York City.
We were planning for a 2-week to a month shutdown, and even that was tragic. When it became obvious that there was going to be a longer shutdown, it became almost crisis.
But hope returned in the summer of 2021. Thanks to rigorous health and safety protocols in September, Broadway was back.
You can't overstate what 18 months without Broadway is like for people that love Broadway, but certainly for the people that work on Broadway as well. So I think everyone is really happy about that. But of course, there's anxiety with Omicron and COVID in general.
That anxiety was well-founded. According to the Broadway League, revenues the week before Christmas fell 26%, dropping from $30.5 million to $22.5 million in a single week. Audience numbers also plummeted by more than 60,000 people.
When we got the announcement that we were closing, we got it over a Zoom meeting. And usually when you get a closing announcement, it's backstage, a producer calls a meeting, everyone knows what it's about.
Joshua Henry has been on and off Broadway since 2008, most recently playing Dr. Pomatter in Waitress after the reopening.
I've been really blessed to close a lot of shows under circumstances that are not COVID related. So this one hurt.
The abruptness of Waitress closing early shows just how unpredictable the pandemic has become.
I think every time anybody tries to think of what's coming next, COVID is like, LOL, best of luck figuring this out, because anything could change in any 24-hour period.
I mean, we were being tested every day, antigen and PCR tested, and I'm still kind of wrapping my mind around it.
But the curtain has not come down on Broadway like it did in 2020. In fact, as of January 7th, 27 out of the 28 shows open on Broadway were performing. A full stop of productions has not been considered.
I just want to make it real clear. Broadway is open, and we have no intentions of shutting down. None. We have 17 shows that have not opened yet that are coming this spring, and to date, they are all planning to come.
The ability to stay open is a testament to the protocols in place, with the league following the advice of 3 different epidemiologists.
One of which actually works directly with us, and we coordinate with the unions the protocols to ensure that the cast, the crew, and that the audience is safe.
Science and vaccines have also changed the morale and atmosphere on Broadway over these closures.
I just try to remember that the world of today with vaccines is a very different world than March 2020.
For Joshua Henry, this break off the stage gives him time to work on his music, spend time with his 3 kids and wife, and admire the fortitude of theater in New York City.
I'm happy that there are shows that are open right now, and I mean, that's just a testament to, like you said, Broadway's resilience.
If you've been to a Broadway show, you know for the audience, there are just a lot of precautions. Mm-hmm. You have to be vaccinated. You have to wear a mask. There are people who go around, and if that mask is below your nose, they do say something to you. So it is safe. But for the performers, it's harder because they don't wear masks, obviously, when they're performing. So.
Yeah. Oh, and you just feel for them. What great interviews they're hearing from them, their accounts. But he's right. The resiliency is what's really cool to see.
They're still pushing through.
Yeah. All right. Thanks, Joe. Yep. Now, this morning, Harry Reid, a giant of the Senate, will lie in state at the U.S. Capitol. Reid passed away last month at the age of 82 after a battle with cancer. A pivotal figure in Congress and in the Democratic Party, Reid represented the state of Nevada for 30 years. He also became one of the longest-serving Senate Majority Leaders ever. NBC News Capitol Hill correspondent Leanne Caldwell joins us now. Hi, Leanne. Good morning. So first, just tell us what we can expect from today's ceremony.
Good morning, Savannah. So yes, Senate then Majority Leader Harry Reid will lie in state at the Capitol today. We expect Speaker Pelosi, Majority Leader Schumer, and Vice President Kamala Harris to give their remarks today. The ceremony is going to be this morning at around 10:30 a.m. And then he will remain in the Capitol until about 4 or 4:30 p.m. when he is then removed and flown home to Searchlight, Nevada. Savannah.
And now, Leanne, Reid spent 8 years as the Senate Majority Leader during a hugely important period. It included the Great Recession and actually most of President Obama's time in office. Tell us, what were some of his biggest accomplishments? How would you sum up his legacy?
Yeah, so Senator Reid was someone who was instrumental not only in President Obama, then Senator Obama running for president, but also President Obama's agenda in key in passing the Affordable Care Act, being able to keep all 60 senators together, 60 Democrats together in order to pass that legislative accomplishment for the former president. And at a memorial service in Nevada over the weekend, President Obama spoke about how important Senator Reid was to him and his legacy. Let's listen.
Harry cared so much about his fellow Americans and so little about what anybody thought of him. It was all searchlight, no spotlight.
During my time in the Senate, he was more generous to me than I had any right to expect. He was one of the first people to encourage me to run for president, believing that despite my youth, despite my inexperience, despite the fact that I was African American, I could actually win.
So he had a big imprint on people's lives. I'm also from Las Vegas, and so I know what sort of imprints he's had on that state and on that city. I have a lot of friends who work for him, and they say that he is one of the most generous, loyal people they've ever met.
Oh, that's great to hear. Leanne, quickly, before I let you go, let me switch gears here and ask about some other Hill news, the latest on the January 6th investigation. The House committee subpoenaed 3 more people close to the Trump family. Tell us the latest there.
Yeah, they sure did. 2 of Donald Trump Jr.'s top political strategists, and then 1 person who was a speechwriter for the former president. The January 6th committee wants to know any sort of information they have on the lead up to January 6th, including the process of writing the former president's speech on January 6th at the Ellipse. Now, 2 of those people have not responded to requests for comment from NBC News, but one of them, Andy Sarabian, said that he will cooperate with the committee, but he doesn't understand why he was subpoenaed. He has no information to give. Savannah.
All right, Leanne Caldwell, thanks so much for covering all of that for us this morning. And let's now get a check on your morning news now weather, which means it's time for Bill Cairns to join. Bill, you got a quiz for me this morning, or what's happening?
No, I mean, Joe wasn't happy yesterday with, you beating him. So, we'll just, we'll just keep it nice and
We'll take a break for a bit.
So,
okay.
All right. So yeah, exactly. So let me give you this forecast. So northern New England is still cold, but it is warming up significantly. So we're getting rid of that Arctic air mass during the day today. It's a chilly start, though. But, we're still at -8 in Caribou, Maine. So Maine will be the last location to get rid of that really cold air. More typical teens right now around Boston. New York City's at 25, DC's at 27. And this afternoon, it's going to be hard to complain. Temperatures will go all the way back up into the 40s, even mid-40s in D.C. New York breaks 40 degrees. So this is a vast improvement over what we dealt with yesterday. But a heads up for Saturday. Saturday now is looking very cold in New England. High temperatures will be in the single digits in Burlington, only 20 in New York once again. That'll be similar to yesterday. And watch out for that football game. New England is playing at Buffalo on Saturday. High temperature of 10, likely game time temperature will be in the single digits, wind chill in the negative numbers. So that could be an interesting watch, just to watch what it looks like them to play in that colder weather. And as far as the only troublesome weather out there today, the Pacific Northwest, we have a rainstorm for you. Snow elevations are very high, so we do worry about the chance for avalanches, but we're definitely concerned with the flooding potential. The green shows you flash flood watches, where you see those little red or maroon rectangles. That's where we have flash flood warnings that are in effect. So we are already seeing some significant issues there because of the heavy rain and the snow melt, and we are concerned with flooding and mudslides. So the forecast for today, pretty quiet in the middle of the country. And Savannah, you survived yesterday. You get to enjoy a little warm-up. Next hour, your weekend forecast, and stay tuned. We have a very big winter storm heading across the country, so details ahead.
All right, that is a tease. And yes, it was freezing yesterday. I did still do my usual walk home. I questioned that decision, 50% of the way through or so, but I completed it. All right, yeah, thanks, Bill. Coming from an Ironman, that means a lot. All right, see you in a bit. Coming up, an incredible story of survival.
It's an absolute miracle here, what you see behind you. How this, and there's no debris, no wires down, no trees.
Up next here on Morning News Now, the quick thinking that's being credited for saving everyone after a medical helicopter crash, including a 2-month-old baby. After the break. Welcome back, and time to take a look at what's making news around the world this morning. Matt Bodner is with us from Moscow. Hey, Matt.
Savannah, good morning. Well, we'll start today off with an update on the saga of Novak Djokovic. The
Serbian tennis star has admitted that he took an interview with a journalist while knowing that he had tested positive for COVID-19. Djokovic is unvaccinated, and there are now questions over a vaccine exemption that he received to participate in next week's Australian Open. The Australian government, by the way, is currently considering deporting him for that. Moving along now to Quebec, where the premier of the French-speaking Canadian province has announced that adult residents who refuse COVID-19 vaccinations will be fined. The justification here is that unvaccinated adults are a burden on the healthcare system, and the entire tax-paying population of Quebec should not be on the hook for that. The premier specified that this would not apply to those with medical exemptions. We finish this hour with some animal news. Archaeologists now believe that medieval horses were, in fact, about the size of a modern pony. This is at least according to a study published in the International Journal of Osteoarchaeology. That is the study of skeletons. The study examined the shape and size of almost 2,000 horse bones from animals that lived between 300 AD and 1650 AD. It is believed to be the largest study of horse bones ever conducted. Savannah?
Huh. That's interesting and not something I had ever wondered about, but I'm happy to now have that information, Matt. Thank you very much.
Now we know.
Exactly. All right, now to an incredible story of survival. A medical helicopter carrying an infant crashed in a residential neighborhood near Philadelphia. Now, miraculously, everyone inside made it out alive. NBC News correspondent Gabe Gutierrez has this unbelievable story.
Good morning. This medical helicopter was on its way to a children's hospital in Philadelphia when it ran into trouble in the air and had to make an emergency landing. Now authorities are crediting the pilot with some quick thinking that apparently saved lives.
That's a helicopter.
It may be hard to believe, but everyone, including an infant who was in this mangled medical helicopter, is alive. And incredibly, no one on the ground was hurt.
I literally see the chopper in the sky, like right there. And so I'm stopped. But then there was a moment where I realized this is going to hit the ground. So that's when I pulled in the reverse.
This man was driving his family in a neighborhood and barely dodged a catastrophe.
This is absolutely a miracle from the Lord.
A miraculous landing, witnesses say, right next to a church.
It's an absolute miracle. Here, what you see behind you, and there's no debris, no wires down, no trees.
The chopper had been flying to a children's hospital in Philly, carrying 2 crew members, a nurse, and the infant. All 4 of them were able to escape the wreckage, even before emergency crews arrived.
Everyone's out of the helicopter.
No word yet on what caused the crash. The NTSB will investigate.
It was absolutely insane. I've never seen anything like this.
Authorities here are crediting the pilot.
This was a miraculous landing.
And perhaps a higher power for a remarkable landing against all odds. Authorities say the pilot ran into trouble about a mile from here in the air and then had to maneuver this chopper in successfully landing it next to this church. What really strikes you here on the ground is just how close this chopper came to that church. And again, remarkably, no one was killed. Back to you.
Oh, just incredible. Gabe Gutierrez, thank you for that story. Now, coming up, the key to your health may be sitting in your kitchen. Up next, what researchers are saying about the many benefits of olive oil, plus more medical headlines in our weekly checkup. All right, welcome back. This is something. A judge has upheld the LAPD's decision to fire 2 police officers. Forget this, ignoring a robbery while they were hunting for Pokemon. According to court documents, the 2 officers were parked nearby when a radio call came in for officers to respond to a robbery at a Macy's department store back in 2017. But camera footage from their car shows that instead of pursuing robbers, they were playing that Pokemon Go video game and decided to pursue a relatively rare Snorlax. Seriously, the officers were charged with multiple on-duty misconducts, including making false statements during an investigation. Now, they pled guilty to 2 of the 6 counts, but then claimed the city violated their rights by using the police car's video system as evidence. Told you, this is something. All right, now it's time for your weekly checkup. We have NBC News medical contributor Dr. Natalie Azar here with us to discuss the latest health headlines you may have missed. Hi, Dr. Azar. Always great to have you. So let's start with this analysis from the American Heart Association. It shows the majority of adults with type 2 diabetes are not meeting their heart health goals. Tell us what those goals are, and also how many people does this impact?
Right. So, I always like to start with why this is important. Well, about 34 million Americans have type 2 diabetes. That's about 11% of the population. And we know that adults with type 2 diabetes are twice as likely to die from heart attacks, strokes, and heart failure. Here are the doctor's orders for you. And I think this is really important. A lot of folks who have diabetes appropriately really concentrate on controlling their blood sugar, and they need to, but there are other targets that need to be met as well. Things like quitting smoking, reducing drinking, staying active, making sure cholesterol is okay. Less than 20% of patients with type 2 diabetes actually are meeting those other targets, Savannah. And of course, the other thing is also your mental and your emotional health. Those psychosocial factors and determinants in health are also really important and need not to be neglected.
Yeah. Ooh, good information there. All right, Dr. Azar, here's the one we just teased. I'm sure people will be happy to hear about this. I am, because I use olive oil every night when I cook. And a new study shows that using more of it is linked with a lower risk of death from things like cardiovascular disease and cancer. So tell us, I'm sure there's everything in moderation. How much olive oil should we be consuming? What's the takeaway here?
So this is great, because you always want to have some take home that's really kind of easy to accomplish. And this is it. You only need to consume greater than half a tablespoon. And by the way, that's not a lot. On a daily
no, not at all.
Right? To reduce your risk of dying from cancer, cardiovascular disease, neurodegenerative diseases, respiratory diseases. And they looked at olive oil. That was a Freudian slip. Olive oil consumption that's used in salad dressing, adding it to food or bread, and even used in baking. So, of course, doctors' orders are that you need to try to find ways to substitute out those saturated fats as much as you can. Use flavored olive oils instead of butter. You can, even something as simple as using it on popcorn, you can do it. And, of course, as you point out, moderation is key, as my mom has always said.
I think some people may contend also that alcohol has helped them in their longevity, but that is really great to hear. Okay, now here's a fun one, interesting one, kind of blows my mind. According to a new brain imaging study, dogs can distinguish between different languages. Okay, Dr. Azar, how did these researchers figure this one out?
Okay, so first of all, anyone who's a dog owner out there truly believes that their dogs understand their language. They do. Dogs are actually.
Yes, we always say Lucy speaks English.
I know, right? I mean, I think they said at one point dogs can know up to 200 words. That's a lot. That's a lot more than a lot of little kids out there, right? So basically, these dogs were trained to understand language, and they basically they trained the dogs to lay motionless in a brain scanner, and then they played excerpts of a story. Look at this picture, Savannah. Wow. I sent this to my sister, and I said these dogs must have been sedated, but they actually weren't. They were trained. My dog would never do that. But anyway, they listened to a story that was read in 2 different languages, and then they measured their brain activity, and they found that the dogs, of course, had owners who had read them the story previously, and different parts of the brain lit up when they were listening to the story in the language that they had listened to it. So, and this was the first time apparently that a non-mammal animal was actually shown to understand language. So the take home here, continue to make your dog a part of the family, read them stories if you want to. They definitely understand. And you can teach old dogs new tricks, because you know what? The older dogs did better than the younger dog.
You know what, Dr. Azar, isn't it interesting, though, that I'm pretty sure no is the same in many languages, and somehow Lucy seems to forget what that one means quite often. All right, that's a fun one, though. Thank you so much. Great to see you. And coming up, sick and tired. COVID's winter wave taking a toll on hospital workers, many now working while infected with the virus themselves. More on the situation that's sparking outrage. Plus, new accounts shedding light on Bob Saget's final hours. Up next, what we're learning about the comedian's last show from those who attended. You're watching Morning News Now.
Some hospitals are taking a dramatic step to fight COVID-19. They're allowing nurses and doctors with COVID to come into work only if they are asymptomatic. Officials say the move is needed to ease staffing shortages, but many are outraged by this move. So what could this mean for patients? NBC News correspondent Priscilla Thompson explains.
Record COVID cases and hospitalizations are putting an enormous strain on hospitals, leading some to take dramatic action. Across the country, hospitals battling staffing shortages now taking an astonishing step, asking healthcare workers with COVID to return to work. What went through your mind when you heard that news?
This seemed like a slap in the face.
California emergency room technician Gabriel Montoya says he was disgusted when over the weekend the state announced that through February 1st, staff who test positive and are asymptomatic may return to work immediately without isolation and without testing. Those staff must wear N95 masks.
If you're relying on the science, then you shouldn't be putting people's health at risk based on staffing issues.
The move comes as the nation's hospitals are facing a double whammy. Daily case counts and the hospitalization rate hitting record highs, while hospital workers out with COVID are creating severe staffing shortages. The combination prompting the CDC to update return to work guidelines for healthcare workers.
It's very callous and it's putting our patients and ourselves in grave danger.
The president of the California Nurses Association says this isn't the answer.
Our patients are in the hospital because they're sick. And for someone to go in there who is positive for the virus, it's a major disaster waiting to happen.
Experts, however, say the change isn't unheard of outside of the U.S.
This is about cohorting, right? This is about having people who are already infected, taking care of infected people. We did this for Ebola in West Africa. It's not one of the first things you'd put in the playbook, but it is in the playbook, and it's towards the end.
California isn't alone. Hospitals in Hawaii, Arizona, Maine, and Rhode Island also changing their policies. One hospital in Rhode Island even confirming an instance of a positive asymptomatic staffer working with patients who didn't have the virus. The hospital posting on their website the move was made due to staffing constraints and that it hasn't led to a COVID outbreak at the facility. Now, a nursing home in the state bringing back positive staff too.
No one could have anticipated the depth of the staffing challenge that we find ourselves in right now. And this latest surge of Omicron is like nothing we've seen.
An unprecedented move for an unprecedented moment. And experts I spoke with say if a healthcare worker is asymptomatic and wearing that N95 mask and an additional mask and a face shield, they should be okay and those patients should be protected. That said, there is still a lot of debate around whether or not patients should be informed that they're being cared for by someone who's positive for COVID. And the same with nursing homes, if loved ones should be informed that their senior who's in a nursing home is being cared for by someone with COVID.
Priscilla Thompson, thank you.
Now, the Omicron variant is also fueling a nationwide teacher shortage that's putting a strain on our education system. As COVID-19 case counts rise around the country and many frontline workers are hit hard, educators and experts are sounding the alarm. NBC News correspondent Zincle Esamoah has more.
As Omicron surges on, teachers are calling out with COVID, leading to a potential crisis across the nation's schools.
That we would like our students to test negative.
In Chicago, in-person classes resume Wednesday. The teachers union reaching a deal with the city after a heated standoff.
Nearly everyone and every student and every staff member in the building had an interaction with someone who had COVID.
The pandemic amplifying a teaching shortage that was already brewing. Nationally, the ratio of educator hires to job openings is on the decline. In June 2021, the ratio was 0.65 hires for every open position. By September 2021, just 0.38. This shortage fueled further by the raging pandemic.
We are underestimating how difficult the job is right now.
Kate Diaz is currently a substitute teacher and president of the Connecticut Education Association.
We're exhausted. I have teachers telling me, I'm barely having time to, go to the bathroom, let alone actually do some work.
The tension palpable, extending through the educator pipeline.
I have personally been involved with several of our superintendents who have actually been contemplating suicide. They've had to deal with the controversies over whether schools should open or not open. And most recently, this thing with critical race theory.
Dan Domenech says superintendents typically managing teachers now find themselves back in the classroom. In Boston, Superintendent Brenda Casalias says she taught an elementary school class in early January because of teacher absences.
Said, I'll clear my calendar and I'll go over and teach a fourth grade class.
In West Contra Costa, California, school was canceled Monday, and school office staff were deployed to cover staffing shortages. The superintendent, Chris Hurst, even substitute teaching at an elementary school. But this teaching shortage is not just bringing educators to the classroom. St. Louis Cardinals player Harrison Bader was even tapped to substitute teach in a St. Louis elementary school.
If there are any substitute teacher openings, let me know.
Still, amid the lighter moments, a grim reality.
As long as we don't have the high level of vaccination on our population, it's going to continue.
What is the impact on students?
You really have a transient teacher population covering. Those kids don't have the same experience. They don't develop a relationship. There's not a consistency, a normalcy to that class.
All right, thank you to Zincle for that report. And now, if you or anyone you know is struggling, please call the National Suicide Prevention Lifeline at 800-273-8255, as you can see there, or text TALK to 741-741.
Time now for our CNBC Money Minute, the biggest financial headlines of the day and why they matter to you.
Silvana Henao is with us this morning. Hey, Silvana.
Hey, guys, good morning. So Pfizer is cutting a few hundred sales positions. This reflects a changing environment involving fewer face-to-face meetings with doctors and healthcare providers and more virtual and telehealth settings during the pandemic. Pfizer says it will try to offset some of the cuts by creating jobs in new areas, focusing on digital efforts. Wells Fargo will stop charging customers fees for bouncing checks and waive some overdraft fees by the end of March. The move follows a similar announcement yesterday by Bank of America. Wells will also give customers 24 hours to bring their balance above zero before charging them a $35 fee. It will start giving people who get direct deposit access to those funds up to 2 days in advance. The changes come amid growing scrutiny of overdraft fees by regulators. And consumers spent $170 billion on mobile apps worldwide last year, according to a new report by App Annie. That's up 19% from 2020. People are also spending more time on apps, an average of 4.1 hours, than watching TV. The most used apps for Gen Z: Instagram, TikTok, Snapchat, and Netflix. Millennials prefer Facebook Messenger, Amazon, and WhatsApp. Gen X and baby boomers are using the Weather Channel, Alexa, and Ring.
Yeah, that's pretty funny. That difference. Yeah.
They're using the Farmer's Almanac and Friendster. Yeah, all right.
Yeah, the weather app. Yeah. All right, now we're learning more about Bob Saget in his final hours before he was found unresponsive in a Florida hotel room.
Those who saw his final comedy show last weekend say he was in good spirits. Authorities have not released any new information about how he died, and autopsy results could take up to 12 weeks. As we wait, the tributes continue to pour in.
Just like having
this morning, fans are searching for answers after the tragic death of beloved TV dad Bob Saget. Just days before he died, Saget joked about previously having COVID on a podcast with hosts Tom and Dan.
It does not feel good. I had it. And,
yeah.
I don't know if I had Delta or I might have had a combo. Maybe at one point they were working together.
Saget did not say when he had COVID or discuss his symptoms, but experts say that information, along with his medical history, will be looked at by the medical examiner.
There is a slight increase in risk of cardiovascular events like a heart attack or stroke after COVID infection. I don't know the rest of his medical history, but that in and of itself could increase his risk.
Saget was found dead Sunday inside an Orlando hotel room. According to the incident report, hotel security found him on his bed with no pulse. Authorities say they found no signs of foul play or drug use. His death came just hours after the seemingly healthy 65-year-old had been on stage. You guys are awesome. His final show, a 2-hour-plus performance, was full of joy and energy, according to those who witnessed it.
Very high energy, very happy, and he kept saying over and over, "I'm just so happy to be here."
This morning, his heartbroken friends and co-stars are sharing their grief and shock at his passing. Full House co-star Candace Cameron Bure called Saget the glue of their TV family, writing, "You weren't just like a father, but one of my closest friends in life." His loved ones mourn. One of Saget's closest friends is remembering how Bob used to say goodbye. Touring partner Mike Young told Savannah how Bob would finish every conversation.
He always ended it with "I love you." He was an "I love you" guy. And he was full of love, man. And he loved his job, and he loved the crowds, and he loved touring, and he loved what he did.
Those who are at Saget's final show say he spent much of the night telling stories and joking warmly about his family, even getting emotional at one point when speaking to a man in the audience who was there with his 3 daughters. Saget, of course, also had 3 daughters, both in real life and on Full House, the TV show that we know him so well from.
Absolutely. We're thinking about those 3 daughters.
Absolutely. People continue to pay tribute.
Yes. All right. Coming up, more than just a game.
Up next, how a racket sport led an immigrant from Mexico to a scholarship, even the pros. This is Morning News Now. We're ending this hour with the story of a young Mexican-American woman and the program that taught her to dream big.
Top story anchor Tom Llamas has more on how the racket sport of squash allowed her and now thousands of students to succeed both on and off the court.
At 4'11", Reina Pacheco may not look intimidating, but in the game of squash, she's a giant. Running opponents like me all over the court.
There we go. Now I'm working you. Now I'm working you.
It's a game she takes seriously because it taught her to dream big.
There were points in my childhood that I just wasn't sure. And when you're undocumented, nothing is secure, right?
At times homeless and constantly in fear of being deported, this type of racket sport was nowhere on Reina's radar until a squash program came to her school in San Diego.
We take low-income students from areas that are often never seen squash before, so they spend half of the time studying and half of the time training squash.
I had to take a bus ride at 4 a.m. in the morning to get to the squash courts by 7 a.m. and I would go to school and do it all over again at night.
The work ethic she developed paid off. Reina would go on to earn a scholarship and play at Columbia University, later joining the Pro Tour. She's now an investment banker on Wall Street.
Pick your spots.
Her first coach gets emotional when he looks back. Proof, he says, this program works.
It's more than a sport. Yeah, it's life, you know.
Currently, there are more than 2,000 kids enrolled in Squash and Education Alliance programs across the U.S. Organizers say 94% of their kids graduate and go to college.
Did squash give you confidence?
Yes, I think that when you step on a squash court and in a different country, in a different court with a different language, and you do it consistently, you become really good at adapting and you become really good at being brave.
Learning to first navigate the court to later lead in life. Tom Llamas, NBC News, New York.
Squash, by the way, is not easy.
No, it's not. I was going to say that, too. I mean, I'm sure no one's surprised that it's difficult for me, as sporty as I am, but it's not. You're right.
Good for her. Thanks, Tom, for that story. And that does it for this hour of Morning News Now.
But the news continues right now.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.